I knew you were going to pick that one.
Well, I mean,
It's good. It's a good starting one.
Dr. Hale, so what is sleep apnea?
That's a great question. So there's a couple of different versions of sleep disordered breathing and sleep issues people can have, ranging from central sleep apnea, which is a brain communication issue, to insomnias and a whole slew of sleep issues. Obstructive sleep apnea is where my heart lies, and that is something that we can correct and help patients with because it has to do with blockages in airflow, position of mandible, the lower jaw, and help people to get off their CPAPs, or at least discuss other options that they might have in conjunction with their CPAP, or to help them get off of it. So for me, when I'm with you in the chair and asking you questions about sleep, you probably fill out more forms for my office when you come to see me than any other dental office you've been in. It's because I'm trying to get a really good picture of what life is like for you when you should be resting. There are times when I ask patients, how's your sleep? And they're just like, awful. Like, it's just their norm. They're in their 30s or 40s or 50s and they've never slept through the night, figured they never would again, and never really knew that there was options to correct that. And I tell patients all the time when I go over their sleep tests with them, you need better air. Whichever form of that you choose, I support, whether that is with a CPAP machine or an oral appliance, but you need better air. And typically they're just sort of mind blown that there is a solution for their sleep issues that they've been having. It just hasn't been screened properly. And dentistry plays a really big role in identifying sleep disordered breathing. It's just not commonly taught in dental school. So a lot of the things that we're told to do for you if you grind your teeth, or you wake up with headaches, or if you snore, really aren't with a sleep apnea mindset. And that's where I'm trying to change everything. My patients are screening, the associate doctors I have here are trained in sleep so that they can identify it, so we can have that conversation. And I spend a lot of time outside of my practice in my busy life with 3 little kiddos training other dentists to identify this properly. Obstructive sleep apnea is exactly as it sounds. It's an obstruction, typically the tongue. If you didn't have braces when you were younger, or perhaps they took teeth out, permanent teeth out for your braces, then the odds are your mouth is small. And if you've been told you have a small mouth, and dental x-rays are the bane of your existence when you have to go to the dentist, then there's very likely some sort of a sleep disordered breathing issue as well. If you don't have enough room in your mouth for your tongue, we need to know that, and I can help you. And just doing a simple home sleep test can rule out a whole bunch of things so that you know if it's a problem or not, and if it needs to be treated or not. But when you go to bed at night and you lay on your back or your side and your mouth opens, the lower jaw drops back and pinches the airway back here. And your tongue just falls to the back of your throat, and that's where the snoring and the loud noises and the turbulent air and the breathing all becomes an issue for you while you're asleep. And believe it or not, dentists can identify your sleep apnea before it's horrible if we get you in early enough and find it.